There is this case of a nurse from Palakkad, Kerala, who's been executed in Yemen. This case of Sister Nimisha Priya had made headlines on many news channels. Although I am nowhere directly related to this case, it has grabbed my attention and I wish to express my thoughts. Please allow me. I have mentioned in my previous video addressing the authorities that there was a specific time frame where international immigration peaked. And because the order of discipline in many departments was disturbed, it led to the rise in crime rate. I would like to emphasize again that it is not only the criminal offense but the situation which compelled the immigrant to commit the crime needs transparency today. And when such cases repeat, it calls for a collective clarity within the operating system. In my previous video, I admit that I gave a silly example of the doctors we saw in the movies of 1970s and 80s. It's been just few decades and it seems that the earth has spinned really fast. Yes, we all have heard that times have changed for good, but the sudden increase in the fake MBBS and nursing degrees has shocked a common man today. Syllabus designed for a healthcare professional is not a joke. With each passing year, the case studies are becoming more and more complex. Sincere and hardworking students felt suffocated when their credibility was doubted. Innocent students were cheated, and those who bought the degrees worked hand in hand with the pharmaceutical companies. Recently, a report was published in the Lancet e-medical journal stating that almost 83% of Indians have become antibiotic resistant. Even our Honorable Prime Minister had risen concern on the serious issue. We cannot deny that every profession has a dark side. But when one of the most respected doctor of our country posted a message on social media appealing the public to avoid the unnecessary intake of antibiotics, a lot of professionals working in the field of medicine understood that now we have really come to the edge. I came across this mass antibiotic resistant phenomena some 6 years ago. That time I felt it was a zonal problem. But within half a decade, it has covered almost the entire nation. This zone is close to my state. A lot of people from the state of Madhya Pradesh are antibiotic resistant. This is a state where excessive mining is done. Let me tell you, our nurses are genuinely concerned, but they do not have a space where they can fearlessly talk about such cases. Moreover, we do not have proper functional lab which conducts frequent inspections on the combination of medicines prescribed to the patients, especially who live in the tribal belt. The condition in which the mass sterilization of women happened in this state has left the entire medical fraternity dumbstruck. Now, before you develop extreme views, let me clarify that people who live both in rural as well as urban lands believe that our doctors are next to gods. Contrary to that, today we have fake doctors who perform multiple surgeries, which also led to the loss of many innocent lives. And they claim that they earned their degrees from overseas. Seldom conflicts amongst the senior and the junior doctors was known to many. However, the rise in suicide rates and the criminal offenses in the healthcare sector is seen as a common phenomena today. Let me tell you, there is no such thing as coincidence in international politics. The churn in the politics beyond borders can be predicted by policymakers, and this also includes wars. COVID and post COVID was not less than a nightmare for Indian students who went overseas to study medicine. Time and time again, medical students protesting on the streets and calling for strikes signifies the suppression of anger, and when unheard, it takes a form of frustration. And in my video, I have already stated where all this is leading to. Despite the darkness in this field, Doctors know no matter what happens in the world, their priority is their patient. It is indeed a matter of pride for us that the Indian surgeons and the healthcare professionals are appreciated for their dedication towards their work overseas. And it takes a lot to build and maintain the trust in the professional environment, especially during this time of conflicts. Of late, due to excessive immigration, the situation has become dicey. Due to the misinformation and malpractices in this field, today the genuine doctors are upset to an extent that their username reads the angry doctor. Their anger is justified, people.